Hello everyone, it's me again. And today we're going to talk about how do diabetes symptoms and complications differ by age. Discover solutions. As we all know that diabetes affects people of all ages, right from children to the elderly. But did you know that the symptoms and potential complications can vary significantly based on a person's age at diagnosis? In this video, we will explore how diabetes symptoms and complications differ by age. But before we begin, please subscribe so you don't miss out on future videos. Also, like and share this video with your friends and family if you find it useful and informative. Let's get started. Type 1 diabetes is more common in children and young adults, whereas type 2 diabetes is more common in adults. Gestational diabetes occurs during pregnancy. Children and adolescents with type 1 diabetes may not initially experience any symptoms or may have vague, general symptoms such as increased thirst and frequent urination. However, some children may lose interest in food and start losing weight. They might also become irritable or fatigued. In some cases, children with type 1 diabetes may go into diabetic ketoacidosis, DKA, which can be life-threatening. DKA is characterized by symptoms such as abdominal pain, nausea, vomiting, and a fruity odor on the breath. On the other hand, type 2 diabetes is more common in adults, especially those who are overweight or have a family history of diabetes. Adults with type 2 diabetes may also experience increased thirst and frequent urination, but they may not lose weight. Instead, they may gain weight, particularly in the abdominal area. Many adults with type 2 diabetes also have high blood pressure, which can damage their eyes, kidneys, and nerves over time. Some adults may not be aware of the symptoms and only get diagnosed when complications arise. Now let's talk about the symptoms of gestational diabetes. During pregnancy, women's bodies produce hormones that can make them resistant to insulin, leading to gestational diabetes. Common symptoms include excessive thirst and frequent urination, especially during the second and third trimesters. Once you have diabetes, whether it's type 1, type 2, or gestational, it's important to take steps to manage your blood sugar levels and prevent complications. Complications of diabetes can affect various body systems, and the specific complications that a person develops depend on many factors, including the duration of diabetes, blood sugar control, and overall health. Children and adolescents with type 1 diabetes are at risk for DKA, which can lead to dehydration, electrolyte imbalances, and diabetic coma. They are also at risk for developing other acute and chronic complications, including those affecting the eyes, kidneys, nerves, and heart. However, with proper management, most children and adolescents with type 1 diabetes can live long and healthy lives. In adults, type 2 diabetes can lead to various complications such as heart disease, stroke, kidney disease, eye disease, and nerve damage. Adults with type 2 diabetes are also at increased risk for obesity-related conditions, such as sleep apnea and fatty liver disease. These complications are preventable and manageable with lifestyle changes and medication. Gestational diabetes itself usually resolves after the baby is born, but it increases the risk of developing type 2 diabetes later in life. Women who had gestational diabetes are also at risk for certain pregnancy complications, including preeclampsia and cesarean delivery. Babies born to mothers with gestational diabetes may have low blood sugar or breathing problems at birth. Managing diabetes is essential to preventing or delaying these complications. This includes monitoring blood sugar levels, eating a healthy diet, engaging in regular physical activity, taking medications as prescribed, and getting regular checkups with healthcare providers. Now, let's talk about the solutions. If you're a parent of a child with diabetes, it's important to work closely with the healthcare team to develop a management plan that meets the child's needs. This may involve frequent blood sugar monitoring, insulin injections, or an insulin pump, as well as education and training for the child and family. For adults, lifestyle changes such as a healthy diet, regular exercise, and weight loss can help manage blood sugar levels and prevent complications. In some cases, medications may also be necessary. It's important for adults with diabetes to get regular checkups and screenings for potential complications. If you're pregnant and have diabetes, it's crucial to work closely with a healthcare provider to manage your blood sugar levels and ensure the health of both you and your baby. This may involve frequent monitoring of blood sugar levels as well as diet and exercise recommendations. Living with diabetes can be challenging, but with proper management, people with diabetes can lead healthy and fulfilling lives. Remember, it's never too late to make positive changes to improve your health. So adopt a balanced diet, stay active, monitor your health, and work closely with your healthcare team. By taking these steps, you can effectively manage your diabetes and reduce the risk of complications. Don't forget to subscribe, like, and share this video. Stay healthy and take care.